Hello everyone. In this video, we are going to learn about drugs acting on the uterus. So here we will learn today about the uterine stimulants and uterine relaxants. So let's start with the learning objectives of this topic. The learning objectives of this topic includes the classification of drugs acting on the uterus, means the uterine stimulants and uterine relaxants, and the mechanism of action of each class, and the therapeutic uses and adverse effects of the drugs, and the understanding of the contraindications and the examples of each class. Let's start with the introduction of the organ uterus before starting with the uterine stimulants and the uterine relaxants. Uterus is a hollow muscular organ which is located in the female pelvis between the bladder and the rectum. And this organ is responsible for the nourishment and development of the embryo and the fetus during the pregnancy period. The uterus is divided into main three parts, which is first is fundus, body, and cervix. It undergoes cyclic changes during the menstrual cycle and responds to hormonal regulation as it is a hormone sensitive organ, and the drugs can stimulate or relax the uterine muscles, and these type of drugs can be used in the obstetrics, for example labor induction, abortion, or the bleeding control. Here you can see the diagram of the uterus. As I said, the uterus is consist of main three parts, which is a fundus, body, and the cervix. The middle part is body part, which is having a three layers. Uterus is having a three layers: endometrial layer, which is the innermost layer; myometrial layer is a middle layer; and the perimetrium, which is a outermost layer. Okay. So these myometrial cells in the fundus act as a pacemaker and give rise to conducted action potential. The electrophysiological activity of these pacemaker cells is regulated by the hormones. The nerve supply to the uterus includes both excitatory and inhibitory nerves, sympathetic components. For example, adrenaline acting on a beta-2 adrenoreceptors inhibit uterine contraction, whereas noradrenaline acting on alpha adrenoreceptors is responsible for stimulation of the contraction of the uterus. Drugs acting on the uterus are classified into two types. First type is uterine stimulants, which are also called as oxytocics. This class include oxytocin, ergotalkaloids, for example ergometrin, and the third is prostaglandins, for example prostaglandin E2, prostaglandin F2 alpha, and misoprostol. And the second class is uterine relaxants, which are also called as tocolytics, in that beta-2 agonist, for example salbutamol, terbutaline, are there, and the calcium channel blockers, for example nifedipine, magnesium sulfates, and non-steroidal anti-inflammatory drugs, for example indomethacin, and the oxytocin receptor antagonists, means atosiban, are there. Uterine stimulants are of three types. First is posterior pituitary hormone, for example oxytocin. Oxytocin is a potent uterine stimulant. Second is ergometrin, and the third is prostaglandins. So let's know about the oxytocin first. Oxytocin is a nonapeptide secreted by the posterior pituitary along with vasopressin. And the actions of the uterus are oxytocin contracts the uterus, estrogen induces oxytocin receptor synthesis, and consequently the uterus at a term is highly sensitive to this hormone. Given by slow intravenous infusion to induce labor, oxytocin causes regular coordinated contractions that travel from fundus to cervix. Both amplitude and the frequency of these contractions are related to dose. The uterus relaxing completely between contractions during low dose infusion. Large doses further increases the frequency of the contraction, and there is an incomplete relaxation between them. Still higher doses cause sustained contraction that interfere with the blood flow through the placenta and causes fetal distress or death. Then The next is our ergometrin. The ergometrin is a fungus that grows on a rye and contains a surprising variety of pharmacologically active substances. Ergot poisoning, which was once common, was often associated with abortion. In 1935, ergometrin was isolated and was recognized as the oxytocin principle in ergot. The actions of ergometrins are: it contracts the human uterus. This action depends partly on the contractile state of the organ. On a contracted uterus, the normal state, which is following the delivery. Ergometrin has a relatively little effect. However, if the uterus is inappropriately relaxed, ergometrin initiates strong contraction, thus reducing bleeding from the placental bed. Ergometrin also has a moderate degree of vasoconstrictor action. The mechanism of action of ergometrin on a smooth muscle is not understood. It is possible that it acts partly on an adrenoreceptor like the related alkaloid ergotamine, and partly on pi-hydroxytryptamine receptors. Next is our prostaglandins. Prostaglandins like PGE2 and PGF2 alpha are potent endogenous uterine stimulants. The endometrium and the myometrium have substantial prostaglandin synthesizing capacity, particularly in the second proliferative phase of the menstrual cycle. The next is our uterine relaxants. They are also called as the drugs which inhibit the uterine contractions. So let's collectively know about all those uterine relaxants. In this, the selective beta-2 adrenoreceptor agonists such as ritodrine or salbutamol inhibit spontaneous or oxytocin-induced contractions of the pregnant uterus. These uterine relaxants are used in the selected patients to prevent premature labor occurring between 22 and 33 weeks of gestation in otherwise uncomplicated pregnancies. They can delay the delivery by 48 hours, time that can be used to administer glucocorticoid therapy to the mother so as to mature the lungs of the baby and reduce neonatal respiratory distress, and to optimize logistics such as making sure the baby is born in a facility with neonatal intensive care. Cyclooxygenase inhibitor, for example, indomethacin, it inhibits labor, but their use could cause problems in the baby, include renal dysfunction and delayed closure of the ductus arteriosus, both of which are influenced by the endogenous prostaglandins. And the oxytocin receptor antagonist, for example, atosiban, provides as an alternative to a beta-2 adrenoreceptor agonist. It is given as an intravenous bolus followed by an intravenous infusion for not more than 48 hours. Adverse effect includes vasodilation, nausea, vomiting, and hyperglycemia. Clinical uses of these type of drugs include induction of augmentation of labor, prevention and treatment of postpartum hemorrhage, medical abortion up to 20 weeks, management of preterm labor, and the control of eclampsia-related seizures. In that, the used drug is magnesium sulfate. And the adverse effects which can cause due to oxytocin administration is uterine ruptures, as it is a potent uterine stimulant. It can damage to the uterine cells or uterine linings, and it can cause the fetal distress. The ergometrin can cause hypertension and the nausea. Misoprostol, it can be responsible for diarrhea and uterine hyperstimulation, and the terbutaline can cause tachycardia and the hyperglycemia, and the nifedipine can cause hypotension or the dizziness. And the contraindications of uterine stimulants means uterine stimulant should avoid in case of cephalopelvic disproportion, malpresentation, and if the previous uterine surgery is carried out or scars of previous surgeries are there. And the tocolytics means the uterine relaxants should be avoided in case of cardiac diseases there, and there are already therapies ongoing of beta 2 agonist. And in case of hypotension is there, the calcium channel blocker should be avoided. And in case of fetal distress or chorioamnionitis, this type of drug should be avoided. And here are the references of the books and the guidelines which I have referred to collect all this information. Thank you so much.